I'm excited to introduce you to our speakers today. So first up, we have Dr. Kira Werstein, teaching professor in kinesiology and health, Master of Digital Health Program, Director of Graduate Education. She specializes in health, wellness, and behavior change courses. In addition to teaching, her professional mission is to translate research into practical solutions, which she achieves through various roles, including serving as faculty member and as a clinical health coach and consultant. Next, we have Dr. Michelle Rusch, assistant teaching professor, my apologies, of kinesiology for the Master of Digital Health program in the Department of Kinesiology and Health at Iowa State University. She has an extensive background in using simulation in healthcare, developing mixed reality applications to offset the effects of fatigue and cognitive and visual impairments. So this will be a pretty quick informational webinar. But like I said, lots of good stuff for you today. We'll have plenty of time left for questions at the end. So we encourage you to submit those along the way. So first, we'll give you an overview of the program with quick information about the curriculum. We'll discuss career opportunities in digital health, the online learning experience, and the student support services available to online students at Iowa State. So let's go ahead and get into it. Kira, can you start by giving us an overview of the digital health master's degree?
Yes, thank you, Megan. This program teaches students to use digital tools and data analytics to improve human health outcomes. Using information and communication technologies, it equips them with skills to do things like manage health behaviors, illnesses, and risks. The learning objectives for the program include integrating digital health technologies, analyzing data, and incorporating innovative technologies. So it combines understanding digital health technologies with expertise in things like human movement, health behavior, and health promotion. In the program, students will have hands-on experience. They'll learn about these digital health tools and the use of data analytics. And they'll also have opportunities to work on real-world digital health projects. A little bit about the curriculum. We've taken a holistic approach, blending the technological innovation with health sciences for advanced digital health interventions. Our program is designed for working professionals, and so therefore we offer that flexible online learning format. The program involves 30 credits. This breakdown includes 4 credits of our foundational courses, and we'll share a little bit more about that. We have 24 credits, which are made up of 8 specialized courses on data analytics, AI, personalized medicine, telemed, public health, and more. And then 2 credits are dedicated to a capstone project. So those two foundational courses, first is called Foundations of Digital Health, and the second is called Research Methods and Ethics of Health Technologies. The Foundations of Digital Health course, it explores the intersection of technology and healthcare. It covers the evolution of digital health, agile methodologies for personalized interventions, and impact of innovation and entrepreneurship on healthcare efficiency. That second foundational course, Research Methods and Ethics of Health Technologies, this course covers research methods in digital health ecosystems, and that includes quantitative and qualitative approaches. It also explores the ethical considerations and regulatory aspects of health technologies, things like wearables, apps, and social media platforms. So those foundational courses will set the stage for our specialized curriculum. For example, students will be inspired with concept ideas and methods for developing projects in these focused areas. So this work can later then be showcased in a portfolio that'll help them be competitive in the job market. And then the capstone project is a culminating applied experience that's designed to give students real-world exposure aligned with their career goals in the digital health field. Those projects may take the form of internships with industry or campus partners, research labs, or healthcare organizations. Could also be a meta-analysis or a review paper. Could be independently done or group-based analyses of existing data. Could also be workflow improvement initiatives or solutions in healthcare delivery gaps. Each of the projects includes documentation and then a final presentation to faculty and peers. These capstone projects are flexible. They are tailored to student interests specifically. And for those who are already employed in a related field, it might also be possible for them to complete a capstone through their current workplace. And that's, of course, pending approval to make sure that it aligns with the program goals. We've got some examples of recent student capstone projects. One example, we have a student this summer semester designing custom digital interfaces to improve communication workflows in a medical office. We have another student conducting user experience interviews and developing a new user interface to enhance the usability of a startup fitness company's online platform. And then a third example, we have another student who is conducting interviews with patients in communities with low resources to identify health needs, and that information will help inform the design of a system for tracking health records. So these are just a few directions that our current students have taken. And so the capstone can be designed to fit each student's specific career goals and interests. A little bit more about the online learning experience. Students can expect to spend about 2 to 3 hours per week for each credit. So that would mean, for example, a 3-credit course will generally take a student about 6 to 9 hours per week. And each course that students take will vary in the types of activities, the assessments, and the expectations of those. So students could expect things like quizzes, applied activities, presentations, and projects, and all of which are in our learning platform, which is called Canvas. Students in our current cohorts have interests in career goals related to healthcare IT, health data management, data-driven decision-making, health insurance, and product development and strategy. So with that, Michelle, I think we're ready to hear more about the career potential with a degree in digital health.
Thank you, Kira. So digital health has real-world applications across various sectors. Examples include enhancing patient care and operational efficiency in healthcare, developing innovative health technologies, and optimizing medical devices and systems and engineering. Our program equips graduates to be competitive and excel in various areas where health and technology converge. This degree will distinguish students in the following areas: healthcare, IT, and telemedicine. This area involves telecare, activity monitoring, and remote medication management roles. And number 2, mHealth apps, where you will be involved with development and management of wearables, glucose monitors, activity trackers, and fitness apps. Monitoring services such as solutions for independent aging, chronic disease management, and post-acute care. And then health analytics, including opportunities with health insurance companies, software and product engineering, and web application development. A degree in digital health opens up opportunities in a variety of fields, from managing risk and improving health outcomes to advancing drug development and delivery. You could also have the chance to lead data-driven health research, shape impactful health policies, and promote population health and disease prevention. There are a wide variety of applications for which you can use this degree and for which you will be well prepared. So the AMA presented a report of anticipated healthcare technology trends for 2025. They highlighted wearables, integration of remote patient monitoring into care models to facilitate chronic disease management, telehealth, tailored messaging, and AI to offset physician cognitive burden. They stressed the need for a thoughtful implementation of these technologies that consider people, processes, operations, and workflows required to properly integrate tools in a way that they bring the most value. 50 years ago, physicians often had 7 pieces of information to keep track of in an ICU visit. Now they are up to 1,300 data points to manage. Our program provides education and training on how to develop tools to collect, aggregate, analyze, visualize, and synthesize this data. These skills will help to help you to become competitive in the job market. So the digital health field is rapidly expanding due to an aging population, increasing chronic disease rates, and changing consumer expectations. Employment is in healthcare occupations is projected to grow with approximately 1.8 million openings annually. Careers in health information technology are expected to grow by 16% in the next 10 years, much faster than the average for all other occupations. Two digital health professions are among the U.S. Bureau of Labor Statistics 2022 fastest growing occupations. These include medical and health services managers, which is projected to grow at 28% by 2032, with a median pay of more than 104,000 annually. And information security analysts projected to grow 32% by 2032, with a median pay of 112,000 annually. The healthcare and social assistance sectors are expected to drive employment growth in the U.S., accounting for about 45% of all projected job gains from 2022 to 2032. And by 2026, there will be a significant shortage of health aides and medical assistants, making professionals with digital health expertise exceptionally valuable. Our program prepares you to offer accessible, efficient, and personalized patient care, ensuring job security and ongoing learning opportunities in this dynamic field. We'd love to have you join us and become a leader in digital health, contributing to innovation in healthcare practices and research. So let's take a look at the return on investment you could receive by joining us in this field. The salary range for this field is wide, as post-program pay can vary depending on several different factors. Your experience, geographical location, and previous education can significantly influence your earning potential. However, the range also indicates plenty of room for growth as you gain experience in this exciting field. In addition to the promising return on your educational investment, your tuition after scholarships alone would stand at $20,700, a sum that could be potentially repaid within the first few years of employment after degree completion. Furthermore, if you're currently employed, you could possibly reduce your out-of-pocket costs even further. Be sure to visit your company's benefits package to learn about any educational reimbursement plans they offer. So now Megan will round out the content portion for us today. Megan?
Yeah, thank you, Michelle. So first, I would like students to know that there is a dedicated person in the program to help with any questions you may have. Amanda Flynn is with us. She provides student support for the program. She'd be one of your go-to contacts, helping answer questions, connecting you with other university services that you might need as you kind of navigate through your time in the program. So you'll probably be in communication with Amanda on a fairly regular basis. So thank you, Amanda. So a little bit more information. Admission to all graduate programs at Iowa State University require a 4-year degree or equivalent from a regionally accredited institution. There is a transcript verification process, so we will need those as well as a minimum 3.0 GPA as a requirement from the graduate college. And non-native speakers of English must be able to demonstrate their English proficiency as well. This program does utilize a rapid admissions process, which means that applicants are evaluated and admitted within 7 to 10 days of applying. With this program, you can apply to start taking classes in August, which is this right around the corner, January, or May. And then just let us know once you get that application started, and we can get the application fee waived for you. This is typically $60 for domestic students and $100 if you're an international student. Something else to consider is that we've had some interest from students that are looking to have like a gap year before starting med school. So if you're kind of in that position and you're considering this something like this could be a really great program to help boost your application. And you can dive into this field of digital health and get some real world experience as well that can help set you apart. Students that are in the any sort of a distance education program at Iowa State University benefit from the distance education tuition rate. Can no matter where you are. So there is a technology fee with that. So as you can see on the screen, there's your cost per credit hour for this upcoming year, the 2025-2026 tuition rate there. And then the technology fee kind of varies based on how many credits you're taking. And if you students enrolled in these programs as well, they're not assessed any of those additional fees that on-campus students would be assessed to take part in activities or services on campus. Iowa State also offers, as Michelle mentioned, there is an opportunity, perhaps depending on what your work situation is, to get that tuition reimbursed. And so we do partner with businesses to kind of help make that happen. So if you need to kind of register for that, you can always reach out to us and we can try to help you navigate that. And I would encourage you to investigate within your work if that is an option. For you. And then additionally, it was mentioned that scholarships are available. So we're offering up to $1,800 in scholarships for students who enroll in this academic year. So if you'd like to get any more information about that, you could reach out to my team or you could reach out to Amanda Flynn. And then finally, Iowa State University offers many academic, career, well-being resources to support our students, from the Center for Communication Excellence to mental health resources like telecounseling and well-being coaching. We're really committed to supporting your success in every aspect of your university experience, no matter where you're residing. So we would be happy to connect you with any of those resources. If you have any questions about those, you could reach out to us as well. So once you're a student, you can take advantage of all that as well.